Hello, I'm Dr. Sarah Williams, and today we're going to address one of the most common yet least discussed topics in men's health: penis size. For many men, this isn't just a matter of curiosity. It becomes linked to self-esteem, confidence, and intimacy. Unfortunately, most of what men believe about size comes from unreliable sources. Locker room talk, cultural exaggerations, and adult films all create distorted benchmarks that leave millions of men quietly questioning themselves for decades. The truth is very different. Large-scale research published in the British Journal of Urology International looked at over 15,000 men worldwide. It found the average erect length to be 13.2 centimeters, just over 5 inches, and the average erect girth 11.5 centimeters, about 4.5 inches around. 90 to 95% of men fall between 10 and 16 centimeters in length, or roughly 4 to 6.3 inches. That means the overwhelming majority of men fall well within a healthy, normal range. The extremes, such as micropenis under 7.5 centimeters, or very rare cases of size beyond 24 centimeters, are outliers and not realistic benchmarks for masculinity. So why do so many men still feel dissatisfied? Up to 60% report worries about their size, even though most are average. The main reason is perception. Adult entertainment often becomes the first point of comparison, and actors are specifically chosen for above-average size. Filming uses angles, lighting, and even digital enhancement to exaggerate appearance. That becomes a mental reference point. Add in boasting or joking among peers, and suddenly a healthy, normal body can feel inadequate. But when women are surveyed, only 5 to 10% say size is very important to them in a partner. The majority care about confidence, connection, and emotional presence. Unfortunately, that's not what young men are taught in health class, at the doctor's office, or in the media. Another factor is incorrect measurement. Many men underestimate themselves simply because they measure the wrong way. In clinical research, we use flaccid stretched length to estimate true erect length. To do this properly, stand upright and use a ruler or soft tape. Place it on top of the penis starting at the pubic bone, pressing gently through the fat pad. While flaccid, gently stretch the penis forward to its natural full length without pain, then measure from base to tip. For girth, wrap a soft tape around the thickest part of the shaft, mark where it overlaps, and measure that distance. Without proper technique, the numbers will always be misleading. This brings us to an important warning. Chasing more through surgery or unproven methods carries real risks. Studies from UCLA show that most men seeking enlargement already fall in the normal range, yet many remain dissatisfied even after procedures. Surgical risks include scarring, reduced sensation, erectile dysfunction, and sometimes permanent deformity. Beyond that, a larger size does not guarantee satisfaction. In fact, in some cases, it can cause discomfort for a partner. What does work is improving overall health. Reducing fat around the pubic area can reveal additional visible length, with every 2 inches lost at the waist restoring up to 1.2 centimeters of length. Improving blood flow is critical, since the penis is a vascular organ. That means eating nitrate-rich foods, such as beets, spinach, and arugula, staying hydrated, quitting smoking, and practicing pelvic floor exercises to support stronger erections. Optimizing hormones also plays a role. Testosterone supports libido and tissue responsiveness, so it is important to check total and free testosterone, SHBG, and estradiol. Natural ways to support healthy levels include getting better sleep, engaging in strength training, consuming enough zinc, and reducing alcohol intake. In some cases, medically supervised therapy may be appropriate. Just as important as physical changes is the mental shift. Stop comparing yourself to unrealistic images and start focusing on genuine connection. Intimacy and satisfaction come far more from confidence, presence, and communication than from measurements. If dissatisfaction with size feels overwhelming, it may be worth speaking with a therapist first, because body dysmorphia is real, and surgery rarely addresses the root of insecurity. The key takeaway is that most men are already perfectly normal. You don't need to be above average to have a healthy and satisfying sex life. What matters most is understanding, respecting your body, and building habits that optimize your health and confidence. When you stop obsessing over size and start focusing on vitality, everything improves. Your performance, your energy, and your relationships. You were never too small. You were simply never told the truth. And if you found this helpful, make sure you subscribe, because we'll keep uncovering the truths about men's health that no one else is talking about. Remember, you were never too small. You were simply never told the truth.